Hello, everybody. Welcome to the global launch of World Day for Safety and Health at Work. It is really good to see you. There are two big aims for this particular day. One is to raise awareness. The other one is to draw attention and make sure that workers' rights are being observed when it comes to safety and health at work. My name is Femi Oke. I will be your moderator for this event. Thank you for joining us. If you speak French or Spanish and you would like to have interpretation, you can find a little globe at the bottom of your Zoom dashboard, and that is where you will find those two languages, French and Spanish, and I am speaking English. Thank you so much. We are going to start our program today because when we're talking about awareness for safety and health at work, our situation that we find ourselves in a global pandemic, means that all of us are going to be leaning in. It is good to see you, Guy Ryder, the Director General of the ILO. Over to you.
Thank you very much, Femi, and let me welcome so many participants to this important event. Dear friends, I think we're all aware that this is a World Day for Safety and Health at Work like no other. We've been living with the COVID-19 pandemic now for more than a year, and the impact on safety and health has, as we all know, been absolutely massive. Everyone in the world of work has had to deal with the risk of infection. Working indoors in close proximity to colleagues or the public has created additional risks, as has shared transport, shared eating places, and accommodation. And some of those workers that we depend upon most have been even more exposed. And I'm thinking particularly of emergency staff, social services and healthcare staff, but there are many more. And as the pandemic has unfolded, we've also seen how its threat extends beyond infection by the virus itself. People with work-related non-communicable diseases have been unable to get the treatment that they need. And some new working practices, and we discovered many of them over the last year, such as teleworking, have themselves created their own OSH issues. Here we can think of psychosocial, ergonomic, and chemical hazards. There's also been an increase in work-related stress and even violence and harassment. And so I think that there could be no clearer demonstrations than these of the importance of a strong, resilient, occupational safety and health environment, both for recovery and for prevention. And this will require better national policies, institutional and regulatory frameworks, properly integrated into crisis response frameworks. We will need effective information and advisory services. We will need sound data collection and research, all of this backed up by good multilateral cooperation and adequate investment. Governments, employers, and workers' organizations will all need to be involved and to work together. Social dialogue will be vital so as to agree and to implement the effective and inclusive responses that we need, ones that work for all, including the most vulnerable and those in the informal economy, who are 6 out of every 10 workers. And together with this tripartite cooperation, international labor standards will also play an absolutely crucial role. They showed their worth already during the pandemic, protecting workers and safeguarding decent work, and now they can help to shape the strong, sustainable, and equitable recovery that we want and need. And that needs to be a recovery with safe work for all. Thank you.
Roberto Suarez Santos is the Secretary General of the IOE. Roberto, welcome. Roberto, thank you.
Thank you very much for this invitation. We really appreciate the effort that ILO is taking in this World Day for Safety and Health. Protecting workers' life and ensuring their welfare has a lot to do with business continuity and business resilience. And it's at the top priority for employers already for many years, but the pandemic has underscored the importance of health and safety working environments. There's no doubt about that. And I keep saying that those who believe that health and safety at work will go back to normal after COVID-19, after we hopefully will overcome the pandemic, those who believe that we'll go back to the normal after COVID-19 on health and safety are wrong. Health and safety at work should and will be enforced, and we are committed as global employer community for that. But beyond that, what appears clearer and clearer is that there will not be a quick recovery, even less a resilient recovery, if we do not answer properly, if we do not give employees and the workplace the right measures for health and safety at work. We want to be very clear on that. We also have witnessed the incredible efforts by workers and employers to adjust work organization, to put in place adequate safety protocols in a very, very short period of time, to secure protective equipment, to encourage workers to adhere to necessary hygiene and distances measures. But there has been many challenges, uncertainties and incoherence among regulations, among protocols, about also risk management, etc. Employers and workers are still dealing with this uncertainty when they have to deal with physical distance, with mask ventilations, air conditioning, tests, vaccinations, among others. We have important set of standards at global and national level. In the international level standards, as Ryder has underlined, gave us a good basis, and we are referring also to Convention 187 to approach the pandemic. But we need good implementation, and we need certainty to create scenarios for greater health protection. And this requires a much better cooperation of the public sector with employers' national organizations. PPPs, public and private partnerships, will be very efficient and will be crucial for access to vaccination, for testing, for prevention. We cannot be successful if our answer do not involve the different stakeholders, including the employers and business community. And in that sense, the added value of ILO is incredible because of this tripartism. The work that we can do together with the workers' organizations, within the social dialogue, to go back better in a different scenario for health and safety is incredible. The disruptive nature of COVID-19 pandemic has also speeded the change of the work at the workplace, working time, working place. Such essential concepts from a health and safety perspective are transforming, and we need to face with them. Basically, we need to ask ourselves, what can we do better in the future? How we can work better together with using our capacities in a more beneficial way? How we can cooperate better with governments and also with employers and workers? What is the kind of incentives that employers and workers need for a sustainable future? Therefore, also we need new attitudes, open mindset, and a culture of preventions. We are committed to that. Thank you very much for listening to me.
Thank you. Joining us from the International Trade Union Confederation, the Deputy General Secretary, Owen Tudor. Over to you, Owen.
Thanks, Femi. For workers, today is International Workers' Memorial Day. We want to save lives at work, not only workers, but everyone who could be affected, including customers, patients, and the public. And of course, we also want to prevent non-fatal injuries and illnesses and promote health and safety as a key part of recovery and resilience. Today, we remember and mourn the dead. According to ILO figures, somebody around the world dies because of their work every 12 seconds, 5 people every minute, 15 people while I speak to you, 300 people every hour. We should have a counter on every screen to remind us that every one of those deaths is preventable if we do the right thing. Today, COVID-19 is the big killer. In the health sector alone, 2 workers die every hour because of the pandemic. And in countries like India, the death toll has spread out from the hospitals into workplaces and affects informal workers in particular. Even in the UK, workers with insecure contracts are twice as likely to suffer and die of COVID-19 than other workers. And women have been placed in harm's way more often, both at work and at home during the pandemic. So while the key demand we are making today is to make occupational health and safety an ILO fundamental right at work, as agreed at the ILO Centenary Conference 2 years ago, we also want COVID-19 recognised as an occupational disease, and we want progress on a biological hazards convention already delayed for 20 years. We want all those rights and protections to apply to everyone who works for a living, so they become universal and inalienable rights as part of a new social contract with worker safety reps at the heart of everything we do. That is our message, that is our commitment, that is our intention. Save lives at work.
Thank you, Owen. I want to take you to the World Health Organization studios in Geneva to welcome Dr. Tedros Adhanom Ghebreyesus. Dr. Tedros, over to you.
Dear Guy Ryder, Director General of the International Labour Organization, Excellencies, representatives of ministries of labor, businesses and workers, dear colleagues and friends. Nobody should die while doing their job. But in the past year, thousands of people in health, care, and other industries have lost their lives to COVID-19 in the line of duty. Many more have died from other preventable occupational diseases and injuries. Today, I join you in paying tribute to all people who lost their lives as a result of their work. The WHO Constitution affirms that everybody has the right to the highest attainable standard of health, and that includes at work. The WHO Manifesto for a Healthy and Green Recovery from COVID-19 urges businesses to put in place initiatives for healthier and safer workplaces, which will not only protect workers, it will also increase resilience to public health threats. 2021 is the International Year of Health and Care Workers under the theme Protect, Invest Together. Now, more than ever, we need a global commitment to safe working environments for health and care workers, investments in their education and training, fair pay and dignified workplaces. Working together, we can bring this pandemic to an end and build a healthier, safer, and fairer world for all. I thank you.
Thank you very much, Dr. Tedros from the World Health Organization. I am just going to take a moment to say, attendees, I see you. More than 1,000 of you joining a Zoom meeting. Now, this is what a Zoom event should look like. I see you in Algeria, in Nigeria, in the hospital in the Philippines. Thank you for greeting each other. As there are more than 1,000 of you, I don't think this event is long enough for you to say hello to everybody, but I am going to send you a warm greeting on World Day for Safety and Health at Work. I appreciate every single one of you. All right, now, that was an important thing to do. I have to bring in, because today we're also launching a report, and that report is very important. So hello, Joaquin Pintado Nunes, and hello, Manal Azizi. I'm going to ask you, Joaquin, first of all, introduce yourself, tell everybody who you are, what you do. You have an important job.
Thank you very much, Femi. So my name is Joaquim Pintado Nunes, and I'm heading the branch of the ILO dealing with occupational safety and health. So you asked me why did we select the topic for this year being on the need to invest in resilient OSH systems. Well, I would say that last year, the topic for Safe Day was already focused on COVID-19 and pandemics, and there could be no other option. Well, we know now that the pandemic is still with us, and we see that things are evolving at different speeds in countries, with some countries already quite advanced on vaccination, some other countries still not that far. And this means that it will probably take a while until we can think of COVID-19 as a conquered battle. So we cannot let our guards down. We also have to think of the longer term effects of this pandemic, namely in terms of mental health. So over the last year, we heard much about the need for strong and resilient resilient public health systems, which is of course correct. But it's also important to stress that we equally need sound occupational safety and health systems which are capable of looking into all components of work that may be affected by the current pandemic of COVID-19 and the very special circumstances that they bring to the world of work. So we should learn with this experience and understand that occupational safety and health is important in any context, independently of the toll of death and illness caused by SARS-CoV-2. Already before the pandemic, our estimates revealed that, and Owen already said this, that on average, 5 people die every minute due to working conditions. So this year, the World Day for Safety and Health at Work is focused on 2 main ideas. First, that in order to prevent a catastrophe like the one caused by COVID-19, or to tackle other potential crises, other epidemics, major industrial accidents, climate change effects, or any other disruptive event, you need to rely on solid occupational safety and health systems, both at national and workplace level. So there is no other option. And this requires investment, both financially and programmatically. The second idea of Safe Day this year and the report that you mentioned is that it's not enough to focus only on standalone parts of national safety and health systems, but you have to consider the system as a whole. And you have to know that not investing in one part of the system can lead to the collapse, to the system collapsing as a whole as well. So it's not enough to, for instance, modernize national legislation if you cannot rely on accurate data on rates of infection when it comes to COVID-19, or data on accidents and disease related to work in general. So this is also why the report for Safe Day this year explains the importance of the main elements of national systems for safety and health at work, stemming from legal, policy, and institutional frameworks, to occupational health services, information and provision of training to employers and to workers, social dialogue, data collection, and other elements of this system, to which my colleague Manal Aziz will be referring throughout this session. Thank you.
Manal, it is so nice to see you. Thank you for being part of this program and organizing the program as well. So you are doing double duty. First of all, I'm going to do this in baby steps. First of all, tell everybody who you are, what you do. Step 1.
Thank you so much, Femi. This is an honor. It warms my heart to see the number of participants. It goes to show how important this is and how it's affected the lives of everyone who works and people who don't work, and how the line between the community and workplaces is even more blurred today. So we have a huge responsibility. And today we have a number of messages that we're trying to get across. Obviously, occupational health suddenly became a frontline specialization all of a sudden. And it's important to say that you can't tackle and address a crisis and try to build an emergency response system while you're inside the crisis. And what we've learned globally is countries that had already a good system in place with good legislation, with good enforcement, data collection, people that are trained. You don't, become an occupational physician in one day. You can't set up a health services system in one day. You can't put together a tripartite committee between workers and employers and different governments, discussing the importance of safety and health, investing in the different tools and methods that we need to be following to ensure prevention of accidents and diseases overnight. So today we are calling for investing in all these elements and leveraging this OSH system that we've talked about through our main Convention 155, through our Convention 161 on healthcare services, through 187, that was a promotional framework to bring these elements forward and to invest in that national policy and invest in your people, in courses at university maybe, in different trainings that can be done. It's not all costly. This is what we want to say. None of us have been saved from this pandemic, and the efforts we do in the workplace are going to have the positive effects in the community and the other way around. And the last thing I'd want to say on that point really is that when you have a national emergency response plan, occupational safety and health needs to be integrated in that response plan and not become a parallel effort on the side, to be able to be efficient and to be able to answer to the needs that the world is facing today.
Now, I'm just thinking about the Safe Day report that we all bring our own experiences about how we are managing a global pandemic, how we are managing to work or maybe not work, the impact that has, lessons learned. Share them with us.
Right. Like I was saying, so many countries have stepped up. So we've seen immediately overnight policies have changed on teleworking, on working time, on paid leave. Policies changed really quickly in order to organize these new work arrangements and to prevent other risks. Because what we've seen, we've heard the ILO DG, we've heard the WHO DG speaking. We've seen that the risk is not just exposure to contagion from a virus. As we changed work arrangements, as millions of people are working from home and others have lost their jobs, we're facing other risks. We're facing ergonomic risks. Can you ensure, Femi, where you're sitting today in Washington, that you have the ergonomic situation and workplace setup that will protect you from long-term harm or musculoskeletal disease? Can I ensure, as a mother of 3 kids, that I can struggle to raise my kids in my home and be able to answer to my job needs all throughout the day, all in one place, in a small apartment? And cases like this are coming out. And this is what we've learned, that people are struggling. They're struggling from isolation. They're struggling from too many things that they need to struggle as they continue to work. And people are just happy to even have a job. Coming here, we're just happy. The ILO recognizes this, and we are one of the few lucky employees that have kept our jobs throughout this struggle and catastrophe that the world is facing. And we're here to try to help others do the same. And the report shows a number of examples across data collection, innovation, across technology, risk assessment, evaluation. The OSH community is listening to us. They have put all their efforts to stand up and stand forth and go to the front line, hand in hand with other public health services to answer to this crisis, as there is no line to contagion and a communicable disease such as this one. But we need to learn other crises may come. We don't want to talk about them, but we need to be ready. We have to talk
now. We have to talk about them. If we're not talking about them, we're going to be in this same situation in 3 years, 4 years, 5 years' time. I love that really direct question you asked. Me sitting here and our attendees sitting wherever they are in the world, do we know we're sitting in the best, optimum, safe and healthy work conditions? That really made me think. I know it made the attendees think. I'm going to push on. And Joaquin, I just want to ask you one last thing, because I am seeing attendees from Kenya, Tunisia, Saudi Arabia, all over the world. I'm wondering about international cooperation, what impact that has as far as OSH is concerned.
Thank you, Femi. I think that's a quite interesting question. So we have seen, even before the pandemic, that there is a growing interest of the international community on occupational safety and health. One example of this is, for instance, the creation in 2019 of the Global Coalition for Safety and Health at Work, which is composed of governments, of employers and workers' organizations, and specialized institutions working in the area of occupational safety and health, and which intends really to bring to the forefront of political agendas the topic of occupational safety and health, but also to disseminate technical knowledge around the world to all countries, regions, and all sorts of organizations in terms of how to correctly address the different occupational hazards.
Right.
We also have seen that even since the pandemic has started, that there is also growing interest from the multilateral partners, both in terms of assisting the ILO and I would say probably other UN agencies as well, to provide more assistance to those countries that are most in need. And we know that national law systems, especially when it comes to attending to the special needs brought by a pandemic, are in very, let's say, critical need for reinforcement. We have seen that many donors, for instance, have come forward to provide more resources for the ILO to be more present at country level when it comes to reinforcing safety and health at work. We also have seen, for example, and I think that this is a clear signal of the importance being given by countries in general to us, a growing number of ratifications of our core or standards. And for example, over the last 6 years, we saw member states ratifying well, we have 10 new ratifications of our standards, and I think that this is quite positive in terms of, well, not only in terms of informing national law, but also in terms of putting national law into practice according to the ILOs, which are to the values that are defended by the ILO, which are very much based on tripartism and the idea of the continuous need to improve the safety and health culture at national and at global level.
All right. Thank you so much, Joachim. Thank you, Manal. We really appreciate you really kind of boiling down the Safe Day report and appreciate the time that you spent with us to do that. I'm going to move on because there has been a lot of support internationally for safe workplaces, healthy workplaces, because the pandemic focused us with a laser focus on what kind of environment we're all having to work in. I'm going to bring in two governments, two leaders, so that you can see there's political will there. Professor Devlet Bilgin is the Minister of Labour and Social Security in Turkey, and Marty Walsh is Secretary of Labour in the United States. We start with Marty Walsh. Hello.
Hello, I'm United States Labor Secretary Marty Walsh. I want to start by thanking the U.S. global partners for their commitment to keeping workers around the world safe on the job, especially during this pandemic. Thank you to the ILO for hosting today's World Day for Safety and Health at Work event. And thank you to everyone for coming together in a time of stress and uncertainty to work together on global solutions for workers' health and safety. In the United States, today is Workers' Memorial Day. This day means a great deal to me. I grew up working construction, and I was involved in the labor movement. I've known too many people who got injured and even lost their lives on the job. And I've seen the toll it takes on families. Those workers and their families are always in my heart. America got through this past year thanks to the dedication of frontline and essential workers. Nurses and doctors, home healthcare workers, grocery store clerks and delivery drivers, farm workers and meat packers, and so many more. Our nation learned all over again that we depend on working men and women for our health, for our safety, and for our communities. So I'm proud of the work we are leading in the U.S. and around the world to protect workers' lives and livelihoods. I'm proud of the work of the G20 OSH network to share best practices for safety and health in the workplace. I'm proud of the work done by this group to develop a strong, worker-centered statement on building back safer and healthier for this year's G20 Labor and Employment Ministers Declaration. The Biden-Harris administration supports the work of International Labor Organization to improve occupational safety and health. We also strongly support including safety and health in the ILO's framework of fundamental principles and the rights at work. We look forward to working with friends and partners to make these goals a reality. Day and every day, we remember and honor those we have lost, and we will not stop fighting to protect those who are living. Thank you for your partnership in this work.
Sayın Başkan, Sayın Bakanlar, İşçi ve İşveren Konfederasyonlarının değerli temsilcileri, değerli katılımcılar, hepinizi saygı, sevgi ve muhabbetle selamlıyorum. 28 Nisan Dünya İş Sağlığı ve Güvenliği Günü vesilesiyle sizlerle birlikte olmaktan mutluluk duyuyorum. Çalışanlarımızın, işverenlerimizin ve tüm çalışma dünyasının Dünya İş Sağlığı ve Güvenliği Günü'nü kutluyorum. Değerli katılımcılar, iş sağlığı ve güvenliği sadece çalışanları değil, toplumun tamamını ilgilendiren uluslararası düzeyde bir önceliktir. Biz bu çalışmalarımızı bu öncelik doğrultusunda uluslararası işbirlikleriyle güçlendirmeyi sürdürüyoruz. 2015 yılında ülkemizin dönem başkanlığında kurulan G20 İş Sağlığı ve Güvenliği Uzmanları ağının eş başkanlığını yürütmeye devam ediyoruz. Aynı zamanda pandemiyle değişen çalışma hayatı ve iş sağlığı ve güvenliği temalı ağın ilk kampanyasına da liderlik ediyoruz. Kampanya kapsamında ILO ile işbirliği içerisinde gerçekleştirdiğimiz anketin sonuçları ILO'nun Dünya İş Sağlığı ve Güvenliği Gücü raporunda yer aldı. Ayrıca kurulmasına yine öncülük ederek sekreteriyasını yürüttüğümüz İslam İşbirliği Teşkilatı İş Sağlığı ve Güvenliği ağındaki çalışmalarımızı da devam ettiriyoruz. Bu yıl Türk İşbirliği ve Koordinasyon Ajansı'nın katkılarıyla Moritanya'da yaklaşık 500 bin dolarlık yatırımla bir iş hijyeni laboratuvarı kuruyoruz. Önümüzdeki 2 yıl boyunca ağa üye ülkelere 20 farklı konuda eğitimler gerçekleştirmeyi planlamış bulunuyoruz. Değerli katılımcılar, Covid-19 salgını ile birlikte gerçekten ender görülen olağan dışı bir dönemden geçiyoruz. Türkiye olarak bu süreci en azından en az zararla atlatmak için sağlıktan eğitime, istihdamdan sosyal yardımlara kadar kapsamlı tedbirler aldık ve almaya devam ediyoruz. Bu süreçte sivil toplum kuruluşlarımızla, sendika konfederasyonlarımızla, iş dünyamızla çeşitli ortak platformlarda değerlendirmelerde bulunduk. Salgınla beraber hastalığın iş yerlerinde yayılmasını önlemek için sahada hizmet veren 45 bin üzerinde iş sağlığı ve güvenliği profesyonelimizi seferber ettik. Bulaş riski yüksek sektörler başta olmak üzere 24 farklı sektör ve çalışma alanına özgü çalışmaları içeren rehberler, videolar, kontrol listelerini tüm tarafların faydalanması için hazırlamış bulunuyoruz. Yayınladığımız rehberler ILO Türkiye ofisi tarafından İngilizce, Arapçaya çevrilerek uluslararası arenada kullanıma sunulmuş bulunuyor. Temizlik, maske, mesafe olarak tanımladığımız tedbirler dizisinin en önemli parçası olan güvenli maske kullanımında ülke olarak öncelik ettik. Türkiye olarak salgının başından bu yana dünyanın dört bir yanından alınan yardım taleplerini 5 kıtadan toplam 157 ülkeye güvenli maskeleri hibesini de içeren yardım paketleri sunduk. Değerli katılımcılar, biz birlikten kuvvet doğar inancında olan bir halkız. Sabır, inanç ve anlayış ve dayanışma içerisinde bu yüzyılın en büyük salgınını aşmaya dair paylaşımcı bakış açımız inanıyorum ki bize her alanda çözümü, istikrarı ve başarıyı getirecektir. Etkinliği tertip eden Uluslararası Çalışma Örgütü'ne teşekkür ediyorum. Toplantımızın tüm dünyada çalışma hayatı için hayırlara vesile olmasını diliyorum. Hepinizi saygıyla, muhabbetle selamlıyorum. Başarılar diliyorum.
You've just joined our World Day for Health and Safety at Work, brought to you by the ILO, and you do not understand what I'm saying. Have a look at the little globe at the bottom of your screen. We have interpretation in French and in Spanish as well. Thank you for joining. I want to give you an example of how one country is dealing with the COVID-19 crisis. And for that, we go to Madagascar. Ms. Giselle Ranapi is Minister of Labour for Employment, Social Services and Social Law. And then we'll also be hearing from Mr. Gerson Rasafimanatoza.
Merci.
Thank you so much. Over to you, Madam Minister. First of all, give us a sense of dealing and how you're dealing with COVID-19.
Merci. Merci, Madame, de donner la parole. Monsieur le Directeur Général du Bureau international du travail, Mesdames et Messieurs les panélistes des différents pays ici présents, dans cette table ronde virtuelle, et Mesdames et Messieurs le groupement des travailleurs et des employeurs, je suis très honorée de pouvoir participer à cette table ronde virtuelle organisée dans le cadre de la célébration de la Journée internationale de la sécurité et santé au travail, surtout en ce moment difficile de pandémie de Covid-19 qui affecte le monde du travail et plus particulièrement mon pays n'est pas en reste. Et justement, je vais parler de la situation de mon pays actuellement pendant cette pandémie. Madagascar est en effet entré dans la deuxième vague de la pandémie depuis mars 2021. Le gouvernement a pris des mesures d'état d'urgence sanitaire allégées afin de préserver l'emploi et d'assurer le fonctionnement minimum des activités économiques telles que la limitation du nombre des travailleurs dans les lieux de travail, dans les locaux des entreprises et l'interdiction aux personnes vulnérables de se présenter en milieu de travail habituel. En 2020 déjà, une étude menée par l'Institut national de la statistique du pays, en collaboration avec l'Organisation internationale du travail, sur les impacts de la COVID-19 sur l'emploi a fait ressortir que l'ensemble des branches d'activité du pays a subi des pertes d'emploi, à l'exception du secteur primaire. Un ménage sur 2 en août, par exemple, et 1 sur 3 en novembre ont constaté une diminution de leurs revenus. Le secteur informel a été victime d'une inactivité généralisée. De plus en plus, environ 9 travailleurs sur 10 n'ont pas accès au régime de protection sociale. Les travailleurs ont subi une baisse importante de leurs revenus. Dans le secteur formel, des pertes d'emplois ont été enregistrées, plus particulièrement dans le tourisme, l'hôtellerie-restauration, les loisirs et les arts qui comptabilisent le plus fort taux de perte d'emploi avec 30 à 40% de taux de licenciement. Devant toutes ces situations, le gouvernement de Madagascar a pris des mesures de renforcement pour la résilience économique des ménages et assurant la survie de la population. Pour les travailleurs du secteur informel, le gouvernement a accordé des aides directes à titre de protection sociale non contributive par la distribution ponctuelle des produits de première nécessité et des allocations financières. Pour le secteur formel, en concertation avec les secteurs privés, afin de soutenir la résilience de ces secteurs face aux impacts de la crise, il a été décidé de décaler les dates de paiement des charges sociales et fiscales des entreprises. En outre, à travers la Caisse nationale de prévoyance sociale du pays, d'autres mesures telles que l'octroi des prêts sans intérêt accordés aux travailleurs en chômage technique ont été prises. Les travailleurs licenciés, les retraités et les rentiers ont également pu bénéficier des aides non remboursables. Actuellement, un plan d'urgence sanitaire pour soutenir le secteur privé est en cours de finalisation par le gouvernement. Ce plan prévoit, entre autres, de soutenir les services médicaux interentreprises, puisqu'on parle de sécurité et santé au travail, et renforcer la capacité d'intervention de l'inspection du travail dans la mise en œuvre des différentes mesures de sécurité et santé au travail dans les entreprises. Notons que grâce aux apports techniques et financiers du Bureau pays de l'Organisation internationale du travail à Madagascar et du projet VZF, Vision Fond Zero, nous avons pu mettre en place des dispositifs de sécurité et de santé au travail dans plusieurs entreprises, ce qui a permis donc de limiter la propagation de la COVID-19 en milieu de travail. Donc, c'est un peu ce que je peux dire à propos des effets néfastes de la pandémie et des mesures envisagées par le gouvernement pour la sécurité et la santé au travail. Je vous remercie de votre aimable attention.
Merci, Madame Minister. Let me just bring in Monsieur Jessen. Minister, what I'm really interested in hearing from is what your OSH challenges are in Madagascar and how, briefly, you're taking those on. This is for
Merci, merci Madame. Justement, les défis, c'est ce que je viens de dire tout à l'heure. On travaille avec le Vision VZF, avec l'Organisation internationale du travail, pour soutenir les travailleurs contre les accidents de travail, par exemple en matière de textile, qui travaillent déjà ici pendant quelques années. Et ça marche surtout pendant cette période de Covid-19, parce qu'il y a pas mal de travailleurs, à part les risques inhérents à leur travail, comme les accidents, il y a aussi les risques de maladies proprement dites de Covid-19 et la vision Zero Fund, VZF, avec l'Organisation internationale du travail, par le truchement du bureau pays, du Bureau international du travail ici à Madagascar, travaille déjà dans ce sens et le défi va dans le bon sens.
One final thought here. We all know that political will is the universal vaccination to pretty much every issue that we have around the world. So if you were encouraging so many of our attendees, we have more than 1,000 people from around the world listening to your words. In conclusion, how would you inspire them? Madam Minister, do you hear me? Go ahead.
Oui, maintenant je vous entends. Merci Madame pour votre question tout à l'heure. Oui, nous sommes dans le sens de sensibiliser tous les travailleurs du monde, de faire preuve de volonté d'éradiquer et de faire face à cette crise sanitaire et de respecter les gestes barrières en milieu de travail sur la distanciation sociale, par exemple, et le port permanent de masques, ne serait-ce que pour éviter la promiscuité du travailleur. Par exemple, à Madagascar, on a fait des mesures, tout récemment, le président de la République a pris des mesures comme quoi, dans une entreprise où il y a plus de 500 travailleurs, par exemple, pour un même local, il doit faire le travail de rotation pour que les travailleurs ne vont pas s'entasser dans un local pour éviter justement la promiscuité et de travailler 250 pour une journée et 250 l'autre journée. Et comme ceci dans toutes les entreprises, dans les locales, pour éviter cette propagation. Et si je peux dire, c'est de respecter les gestes barrières en milieu de travail, mais aussi protéger les vulnérables déjà et ne pas faire appliquer trop les textes en vigueur pour les congés payés, comme ça, mais il faut alléger les traitements des congés par rapport à ces vulnérables. Et c'est ce que Madagascar a fait tout récemment. Merci.
Thank you so much. I appreciate the perspective from Madagascar. Appreciate you. I am now going to have a much larger conversation. You always know when you're at the ILO or the ILO comes to you via virtual conversations, that there will be representation. So the panels will be epic, and I love epic panels. I want you to meet the panelists. The first thing they're going to do is they're going to introduce themselves, and then we're going to ask them some of the key questions that we are asking for this World Day for Safety and Health at Work. So let's start with Jeanette Gallany. Jeanette, hello, welcome. Introduce yourself to our audience.
Hello there, my name is Jeanette Galanis. Can you hear me?
Yes, we can. Hello, Jeanette, go ahead.
Can you hear? Okay,
yes,
great.
Yeah.
Hi, my name is Jeanette Galanis, and I'm the Deputy Assistant Secretary for the United States Department of Labor, and I represent the Mine Safety and Health Administration.
Good to have you, Jeanette. Silas Sun, welcome. Introduce yourself.
Hi, good afternoon. My name is Silas Sun. I'm from Singapore, the Manpower Ministry, and I'm currently the Commissioner for Workplace Safety and Health in Singapore. Very pleasant to meet all of you all.
Oh, nice to meet you too. I'm looking forward to our discussion. Maria Fernanda Campos, welcome.
Thank you, Femi. Hello, everybody. I'm really happy to be here. I'm Maria Fernanda Campos, Inspector General of the Authority for Work Conditions in Portugal. So thank you so much.
Thank you. Your title is so long, you just check to make sure you got it right.
Yes.
I don't blame you. You've got a lot of weight with that responsible title.
Yeah, no doubt. Thank you.
Selçuk Yasser, nice to see you. Introduce yourself to our audience of more than 1,000 people around the world.
Hi, Femi. Hi, everyone. Thank you for giving me the opportunity. It's a pleasure to be with you all today. I'm Selçuk Yasser. I'm head of International Collaborations Unit of Director General of Occupational Safety and Health in Turkey. I represent both Turkey and the G20 OSH Experts Network. Thank you.
Fantastic. Chris Demister. Chris, hello. Welcome. Tell everybody who you are, what you do.
Hello, Femi. Good afternoon. And good afternoon to all you, dear friends and colleagues. I'm Chris Demister from the Federation of Enterprises in Belgium, dealing with everything that is health and safety or well-being related, and also representing the international business community, the International Organization of Employers in this discussion.
Nice to have you. Hello, Maureen. Maureen Onia. Nice to see you. Welcome. Make yourself visible and join our conversation. Introduce yourself to our international audience.
Hello, Femi. You have to allow me to start my video. Anyway.
Maureen, you can keep talking while you start the video, then the two things will happen simultaneously.
My name is Maureen Onya Ekwazi, Head of Occupational Health and Safety for Nigeria Labour Congress. Thank
fantastic.
you. Yeah. Hello,
Thank
everyone.
You. Yeah. Nice to see all of you. I'm so looking forward to this conversation because every single one of us knows what it is now like to live in a global pandemic. You're all responsible for workers. You're all responsible for policy. So hearing where the way forward is and how to have resilience in all of your different fields is going to be fascinating. Jeanette, where do you want to start? Where do you want to take us? How's your year been for health and safety?
So the United States has had the same year that most other countries have had. In particular, for me, with the mining industry, miners in the United States are considered essential employees. And so the mining industry, while suffering some economic setbacks, did not suffer as much as many other industries in the United States, at only 10% of a decrease. As you know, in mining, we produce the energy that runs hospitals and homes, and we produce the materials that make medical devices and other essential items for living. And so a 10% decrease in production is not that great for an industry here in the United States. And in contrast to that, the fatality rate of miners rose in 2020. For example, in 2019, the fatality rate for American miners was less than 1%. And in 2020, that rose to 1.2%. And so there's only one reason this can be, and that's related to work-related stress on the job and miners in an environment where safety precautions have been put to the side in order to maintain production levels with a smaller staff, because the American miner, just like any other worker, was catching COVID just like at the same rate of any other American worker.
Yeah.
I think when you look at the stress-related, the job-related stress in the mining industry and the fatality rate, we do not expect that to go down in 2021. And as an example, we are at a decade-time high this year of fatalities at this point in the year in the mining industry.
Jeanette, do you mind if I ask you, what do you do about that? Because I've seen this in other industries, for instance, the meat production industry. People were going to work when a lot of people were sheltering inside, and they were in more danger than any other kind of worker who didn't have to go into work. So this is really disturbing. Now, what do we do with this moment? How do we make health and safety a priority?
So for us, in the United States, we have a new administration, a new president, who believes in science and takes the word of the Center for Disease Control very seriously. And with this, there are two agencies within the federal government that control worker health and safety. One is the Mine Safety Health Administration, which is guided by its own laws and its own congressional actions. And then there's the Occupational Safety and Health Administration, which is the entire other sector, every other sector.
Okay.
Each one of us, each agency has to pass what we call an emergency temporary standard, which is a regulation that we pass to address COVID. OSHA, which is the other agency, is in the process of passing their gigantic piece of emergency legislation, emergency rules and regulations, excuse me, not legislation. And MSHA has just completed theirs and will submit that to the Secretary of Labor today.
All right.
And that will cover very specific areas of a mine, right? And
now I'm going to share. I'm going to share the
add,
conversation. Just finish your sentence. I'm going to share the conversation with your co-panelists. Just finish your sentence, because it means that it's very relevant that today is the day that is going to be submitted. Finish your thought very briefly, Jeanette, because I need to move on.
Sure. That will dovetail with and complement the efforts that we have to control dust that cause black lung disease in miners and silicosis in miners. Because COVID attacks the lungs, we are particularly focused on those parts of the mine and that part of the industry where exposure to respirable dust is at the highest
level.
Thanks,
Jeanette. Thank you. I want to bring in Silas here, Silas, because you have a list of, we need to do this, this, and this. It's a checklist for what we need to do now that we're in a global pandemic and how we get out of the global pandemic. Share some of those thoughts with us, Silas.
Thank you, Femi. Well, I think like all other countries, we have quite an eventful year. And I think for us in Singapore, the main approach that we have taken is what we call, in colloquial term, a whole of government approach. Very similar to what Manel had earlier mentioned about OSH being integrated into the entire response plan with respect to tackling this COVID. So for us, it is not just the Ministry of Manpower, it is not just OSH being involved on the front line of this COVID pandemic, but it is bringing the entire army of all the government bodies from health, manpower, national development, transport. Everybody is have to come into play to combat this pandemic together. So I was just reflecting about what Jeanette earlier mentioned about them OSHA passing the law. For us, we also had to pass a law. So the thankful thing, I think, for Singapore is we could do it very quickly, and because of the urgency, Singapore is a very small island country, and we rely on a lot of international trade and people coming into the country. So very quickly, the various agencies, including the Manpower Ministry, the Health Ministry, we all work together with our lawyers and we could quickly come up with a piece of law and had it sailed through, passed through Parliament, which enacted it in double quick time. I think this was done in recognition of the urgency of the pandemic, and then that was, I think, something that we could quickly move in a very agile manner, and
Silas,
that helped us in the response.
Can I ask you to be candid, because there are many countries that have laws, and there's laws and there's implementation.
Sure.
And sometimes when it is politically expedient, those laws, particularly when it relates to workers, are not adhered to. And there's a huge conversation that we could have. We'd have to have another Zoom meeting to have that conversation about implementation and workers' rights. But you're saying this sounds extraordinary. Double quick time. The law was done in double quick time. What is the impact? Are you seeing impact? Is that possible?
Sure. The impact was huge because immediately after the law, even as we were gearing up for the law, the respective agencies, we were mounting out and appointing enforcement officers to quickly go down to the ground. So I'm responsible for the team, what we call safe management measures, enforcing all the safe management measures. I was responsible for the workplace. There was a separate agency like the Maritime Authority. They were responsible for those dealing with the port, the ships coming in and out. We have the Construction Authority dealing with all the work sites. So different parts of the government all stepped in and mounted a integrated response to help combat, because really this virus has no respect of boundaries. It doesn't care whether you're a housewife or you're a blue collar worker, white collar worker, IT worker. It doesn't care. And I think and because of that, we had to recognize that we had to mount all this a very comprehensive set of measures that covers all aspects of our society. And that even includes even in cinemas, when it was closed, or rather when it was eventually reopened, the cinemas were there was a set of strict laws, what they were told, how many people they can admit, and what is the protocol to adhere to. So all this were in a way carefully orchestrated throughout the whole government.
Thank you for sharing that with us. I want to go to Maria, because Portugal now has leadership of the EU. So I'm just really intrigued by what the EU is doing regarding worker safety during this global pandemic. Can you enlighten us, please, Maria?
Yes. Fortunately, we are not alone. It is a huge problem for all of us. So under the umbrella of European Union, we have a strategy, and the European Union have a document they build with all member states to take care to harmonize the rules between the member states about the health and safety at work. So we build that together, and then we build our own national strategy. So it is really important to be together on this, and it is really important to have a regional strategy for this. So we take a focus on this important issue, safety at work, and healthy, to have a dignified work. It is really important for the European Union, and also for Portugal, also for all of us. So for economy, for social cohesion, for everything we have in our society, our style of life. So it is really a good methodology to work together, to have a document and to build together with the member states to focus on this important issue.
Maria, I am wondering, as a former member of the EU, that it is quite difficult for many countries to work together, or does that make it easier to, when everybody is experiencing the same pandemic, to come together and make good health and safety policy? Was it challenging or easy?
It is a challenge, no doubt, but we has been doing a path. We are improving. We have several agencies in EU to build this strategy and to make it easy, like the SLEEK, like the OSHA agency, like the NETOSH. We have a lot, several instruments to deal with it, and now and to enforce the strategy, like ILA, the new the new European authority, labor authority. So it is a lot of instruments the member states are building under the EU to make to enforce and to take to can harmonize between member states this strategy and to improve the work conditions for all workers in Europe. So it is not easy, it is a challenge, but we have space to discuss, to meet and to discuss and to build to improve better.
Thank you, Marie, for bringing us that view from the EU. I am just reminding myself of the subtitle for our event: Anticipate, Prepare, and Respond to Crises. I know that there is a bilateral conversation going on in the chat with 1,000 people. I love that conversation. I'm watching your conversation, listening to this conversation. I know you're doing both. In the chat, also, take this on, help each other, anticipate, prepare, respond to crises, not even just this one, future ones. Selçuk, let me just bring you in here, because Turkey is thinking about how do we mitigate the impact of COVID-19. Share those thoughts with us. Tell us what Turkey is doing.
Thank you, Femi. Actually, Turkey, as Turkey, we ratified the ILO Convention 187, and this describes the elements of occupational safety and health system. Therefore, our response to COVID was overlapping with the ILO Convention 187, and it was timely, it was comprehensive, and it was robust as well. So we considered new and emerging risks, measures to be taken, health surveillance, safe return to work, classification of sectors, workplaces, and job tests, and vulnerable groups, of course, and we provided strong guidance on all of these issues. Considering the high-risk profile in terms of COVID-19 spread, we prepared informative documents for the prioritized sectors and employees, such as bakery production, supermarkets, pharmacy, and cargo transportation staff. Also, in cooperation with ILO office in Turkey, we translated these guidelines to Arabic for migrant workers. We launched a COVID-19 online platform to make all this useful information and guidance easy to access for all parties. And through this platform, current news and frequently asked questions were also provided. The healthcare workers, they become our heroes during the pandemic. A mental health support application was developed to provide psychological support to them. It's a mobile application which they can receive support 24/7 from specialist physicians via video calls. We follow the three-step methodology for collaboration with stakeholders. First, we established an advisory board consisting of academics from the various disciplines. Then we shared our studies with all our stakeholders. Finally, we provided technical information on OSH by taking into consideration the demands received from public institutions and organizations. Continuity and sustainability of OSH services during quarantine and restriction was one of our priorities. We focused on not only the market surveillance and inspection activities of personal protective equipment, but also expanding the scope of notified bodies, diversifying the test infrastructure, informing manufacturers, and most importantly, ensure that the products to be offered to healthcare workers are safe.
Selçuk, if I may, because of course you want to highlight everything that you're doing in Turkey regarding workers' safety and health. What has worked the best? Because you are listing, but what are you proudest of?
Actually, I can say that we provided strong guidance to the employers, to the employees, to the all parties. This COVID-19 platform is rich of information. There are lots of information. And also, you know that many international events were canceled due to pandemic. So we started preparing a bulletin in order to share the global challenges, the global developments on occupational safety and health related with COVID-19 especially. So with these monthly bulletins, we informed people, we call them to take action. So also we work very close with the stakeholders, with social partners. So I can say that this is the strongest point of Turkey's COVID-19 response.
And the other one that leapt out of me, and I think this is true of every country, everywhere, is translating guidelines into language that everybody can understand. So that to me was like, oh, good job. Love that. Because that's just about communication. It's like, how do you effectively communicate? And that was effective communication right there. Chris, I'm very aware that we've been talking a lot about workers. In fact, for over an hour about workers, but what about employers? Bring us that perspective, please.
Yeah, thank you. So for employers, of course, the big challenge was, first of all, trying to make sure that there was some business continuity possible. In most cases, it was limited to what was called essential sectors or essential activities, but later on, stepwise, also other kinds of activities were made possible again. But of course, the challenge was, how can we do that at maximum safety? Knowing, of course, the limits in dealing with a virus. So how to do that? And there, I think I have a success story to share, because what we actually did is, it's more than just translating the language. It is translating the basic principles, social distancing, ventilation, hygiene, action in case of illness or symptoms, translating those principles into tangible and practical measures. And that is what we did. And how we did it is jointly. We did it jointly as social partners, so not just the employers, but together with the workers. And we got the confidence, we got the green light and the trust of our Minister of Work to develop those guidance, those practical guidance tools for the businesses in order to ensure their continuity. And that was essential because we given the people something tangible, not just letters, not just words on paper, but with very clear instructions, practical measures, often using the creativity of individual workers that came up with great ideas. That is the success story. And later on, we continued to be on the same line as social partners when it came to governments asking us, should we prioritize some worker groups for vaccination? How can we impose testing? How should we test? We stayed on the same line. We said, no, do not prioritize. We don't want to fight. How can I say your job is not essential? I will give a vaccine to that worker first. That is creating a fight among workers, and that's not helpful. So we urge them to speed up vaccination for everyone, to make testing available for everyone without targeting specific groups. Where did we fail or where did we do not so good? That is in creating synergy between public health and workplace health. We still have the feeling, and it's not just in my country, in Belgium, but throughout the world, that the people in charge of public health are not aware or not willing to be aware of the powers and the structures that we have at work. We have the prevention principles. We have long-standing experience with prevention and prevention measures. We have consultation. We have inspection tools, but none of that was used at the benefit of the society as a whole. For the society as a whole, for the public domain, the principles remain the principles. They say these are the measures, but they don't translate them into something tangible, in something concrete. Mm-hmm. So that is, in short, my story. And what we have developed was later, with the help of the International Organization of Employers, developed to a more international version. And that was later adopted in Russian language, Spanish, Serbo-Croatian, Georgian, and now also Armenian. So quite a success story.
Mm-hmm. Thank you for sharing that with us, the employer's perspective. Going to go back to the worker's perspective. Maureen, would you unmute yourself and would you make your camera live so that we can see you? Maureen, let me just remind you, is Head of Occupational Health and Safety, the Nigeria Labour Congress. So it is good to have her and her perspective in the conversation. Go ahead, Maureen. I know I was following what was happening in Nigeria. Very challenging time to stay safe and healthy anywhere, let alone at work. What were your challenges?
Okay, good afternoon, everyone again. I'm sorry the video is not, for reasons you cannot allow me to show my video. However, the challenges at work are very enormous because the COVID-19 came and there were lockdowns everywhere. Many people were not able to go to work, markets were closed, schools were closed. Then, okay, can you see me now?
Yes, keep going, Maureen. This is not necessarily the most flattering angle, yes, but I do love the African print. So keep going, keep talking. Maureen, keep talking.
The major challenges we faced, yes, was workers' inability to go out. You know, most workers are in the informal sector. These are people who depend on their daily earning to feed. So workers were hungry. There were starvation. People now said, okay, instead of staying at home to be killed by hunger, why not go out all day and make monies for themselves and their families and let COVID kill them? That was that kind of situation. There were so many workers at home. There were so many domestic violence going on at home because couples were forced to stay together. In fact, incest increased in Nigeria because of the lockdown.
So Maureen, can I ask you, because I've seen that situation in Nigeria. I saw that situation with migrant workers in India where everything just stopped and there was a humanitarian crisis as well as a health crisis. Now, being more resilient, what does that mean, knowing that happened? Because we can learn lessons from that. Now, what do you do?
Now, the lessons to learn from that is that our government needs to be prepared with social security issues for Nigerian workers, because those humanitarian crises happened because there were no social security for Nigerian workers, no palliatives of whatsoever for Nigerian workers. So people were scrambling to be able to feed. And that is why people have lost their jobs. Now, what we are trying to do is to engage the employers, engage the government to ensure that people are returned to job. There is also serious issues with awareness. A lot of people have problems assessing the awareness of what is actually going on. Now, people are not ready. Nigeria is not ready with the type of form of work that is happening now. Working from home, not many people coming to work. We are not ready for that. So these are part of the challenges. We conducted some interviews among our workers to find out exactly what happened to them during this period. And they have gory tales to tell. So for us, we think that we will continue to engage the government to come together as social partners to see if we can establish a way forward, especially to build the resilience of systems, as we have talked about today, so that we can ensure that workers have their benefits of occupational rights at work.
All right. So panelists, I want to get one last piece of great advice from you, but I'm only allowing you to do it in a sentence, okay? Only in a sentence. So Maureen, as your camera is working, we see you.
Yeah.
I'm going to get you to start, because what we wanted to learn from this is, how do you respond to a crisis, prepare for future crises? Your advice is what? In a sentence, Maureen.
Is a call from all trade unions all over the world that occupational health and safety should be made a core convention of the ILO, so that employers and workers, employers and their governments should be held accountable in what is happening at the workplace.
All right. Thank you. Said with vigor. Chris.
Yeah. Be open about the figures and collaborate. Use the wisdom of the crowds to come up with the best possible solutions.
Selçuk.
I'm hopeful that everyone will come out of pandemic with a renewed sense of how important occupational safety and health is, and we bring those values into the future.
You certainly helped us do that. Maria.
Education a young generation for have work safe and healthy, and work together. That social dialogue is really important, and bring together for the companies, for the workers and employees, work together for the future implement of OSHA entirely in the work environment is really important. Thank you.
Thank you. Silas.
Let's not waste a crisis. Let us lock in the COVID gains.
Jeanette.
I agree with Chris 100%. Employers are the key, especially now moving forward, to vaccinate the public. I think that there is much work to be done in coordination with employers around vaccination efforts and legitimization efforts and trust in the vaccine.
Thank you, Pan. I appreciate you. Thank you, attendees. You are fantastic. There's so much action going on in the chat. Love that. To close our World Day for Health and Safety, brought to you by the ILO, we have Vera Paquette-Padigal, Director of Governance at the ILO. Vera, over to you.
Thank you, Femi. And it's my honor to try to wrap up what we've been following with so interesting, the panelists, but also the words of the global event. First of all, I wish to thank the distinguished speaker for their valuable time and insights. This has been a fruitful and timely discussion as the world of work continues to feel the strong impact of the ongoing COVID crisis. We have seen the devastating effects of the pandemic on human life, and I think Owen has mentioned about the devastating what we are also suffering about losing lives, employment, working conditions, and business activity. These effects fell across the globe. No region are being spared. All regions and countries, but all workers and enterprise have been affected. We have also seen that occupational health, together with public health, measures play a fundamental role in preventing and mitigating contagion in workplaces. Safety and health at work is also important to address all occupational risks to which workers are exposed during the pandemic, specifically psychology, risk arising out of change into working arrangements. And Maureen has mentioned of them. Working from home is not something that we are used to. Today's session has confirmed that strong occupational and safety and health systems at national, sectoral, and workplace level are indispensable to continue to address COVID-19 effectively. To prepare for recovery and to address future crises we may face, and to protect our young generation, as Manuel had said. We have seen the importance of good OSH policies and programs at national and enterprise level, based on social dialogue, for keeping workers safe and healthy. We have seen that international labor conventions, labor standards, namely 155th and 187, provide a solid reference for the development and adaptation of national laws and policies to address the safety and health challenge of COVID-19. We have also seen that how investing in OSH is relevant for advancing decent work, protect life and integrity, business continuity and resilience. But we must include and we must think about those special measures targeting the most vulnerable, those who are in the informal sector, in the informal economy, which don't have sometimes the protection they need. We have heard throughout the session how different governments, employers and workers have tackled the pandemic, including through collaborative approach and innovative use of technology to keep workplace safe. Finally, we've seen that there is a renewed commitment towards occupational safety and health, and allow me to reiterate that this is just the beginning of an important conversation and movement towards stronger and more resilient solutions to advance a safety culture. This is the central message of the World Day for Safety and Health at Work, the need to recognize the importance of occupational safety and health for preventing and managing crises, which requires a global and national collective effort to invest on occupational safety and health infrastructures. Dear ladies and gentlemen, thank you for being with us, and I wish you the rest of a good day and safe day. Thank you.
Thank you, Vera. Thank you, speakers. Thank you, more than 1,000 attendees. This session is now closed.
Goodbye, everybody. Good night.
Bye-bye, everyone. Bye.
Goodbye.
No, le za sy ny tena nge sy problema fa tena le message